Hi, this is Alan Stevenson. I've been wanting to do this for quite some time and I've just been putting it off, but I thought I would make a video just showing you Patient Connect and how it works. First of all, when you go to the polygonhealth.com/map/multiple myeloma website, the first time it'll be a little bit different, so you can set up a profile. I wanted to assure you that we do not ask for any personal information. And I am showing you the desktop version, but the mobile version works the same way. We are creating an app for this, and it should be out pretty soon. But we can go ahead and I'll just sign in. You can sign in with Facebook or sign in with email. You do not have to be on Facebook to use this. I'm just going to go ahead and do it with Facebook. That's the way I did it the first time. However you do it the first time, that's the way you need to do it every time. So once you are logged in, it'll immediately pull to your PIN. So part of the sign-on process is when you create your PIN, create your account, it's going to ask if you're a patient or a caregiver, medical professional, researcher, etc. And you just select which one. You select your city or zip code, and then it'll ask you to tell your story. And you can say as little or as much as you would like. As you can see, I went in and I told about my story. I said I'm the founder of the Multiple Myeloma Warrior community, my race, age of diagnosis, current age, where I'm treated, what treatments I've been on. You can just tell as much as you want to about that. And then also I will go to my profile right here, and AI will read my story and it'll actually make suggestions about other things that I might want to put on my story. Also, there is a summary that AI looks at at what you put into your story, and it'll tell you how many other people have reported the same. For example, I said that I'm treated at UAMS in Little Rock. It'll actually show me how many other people reported being treated at Little Rock, in Little Rock. So it says 35 similar members. I can actually click on that. It'll show me who they are. One thing I want to mention to you also is that it automatically defaults to a member number. But when you're setting up your account, you can actually change that to your name. And if you already have a PIN on here, you can go back and edit your PIN, and you can just change it to whatever you want, whether it's your name or first initial and last name, however you want to do it. I do believe that it's better if we do put our name on there, because part of this is just connecting people together, and you'll see people in the group that are active and you might want to connect with them. So I think that's very important. I'll go ahead and go back, and I'll also show you one other feature here, and there is a chat where you can chat with people about that are in this UAMS category. So you can chat with other people that are going to UAMS. And then you can also chat with people about the different treatments. So I did VDT PACE treatment and tandem stem cells. So just some helpful hints there. And let's see, going from there, I'll also show you that we have messaging capabilities. So you can send people private messages, but we also have public group chats that are topic specific. So, we have one about what is CAR T therapy, and we also have a lot of local support groups that are using this. Here's the Norfolk, Virginia Beach Myeloma Support Group. We've got one for Memorial Sloan Kettering. Let's see what else. Austin Myeloma Support Group, the Villages Myeloma Support Group. So Tampa Bay, St. Petersburg. So if you have a local support group, this is a great way of connecting with people. And this hasn't been out all that long. People are still learning about it, and that was one of the reasons I wanted to do this video. So don't forget about that. You can learn a lot from that. And then also Like I said, you can get involved with other with support groups and such. Another thing that we have that a lot of people aren't aware of in the resources section is what we call Knowledge Connect. Now, what this is, it is an AI-powered frequently asked questions section. And we broke it down into the disease, the treatments, living with multiple myeloma, financial resources, and then we also have a place for paid studies. And these are paid market research studies. Currently, we have one going right now that we just launched yesterday. So that'll change from time to time. But I'll show you how this works. So these are questions that are either asked in the Facebook groups or should be asked even. A lot of times you don't know what to ask, right? So is multiple myeloma hereditary? You click on that and it gives you really good information. It is not real technical on most of these questions. What are the 8 types of multiple myeloma? A lot of people don't even realize there are 8 types. So, and it goes into each one of them, just gives a brief explanation of what it is. And like I said, this is all AI powered, so it will automatically update. I'll go back over here. There's the treatments. What is VDT PACE? That's what I did. What is a stem cell transplant for multiple myeloma? And that gets asked a lot. Obviously, my internet's been a little bit slow today. There we go. It'll give you, and it'll also tell you not only the answers, but also tell you where it's getting this information. And then there's some additional resources. So you can dive into this as deep as you would like. Also on financial resources, a lot of people do not realize how many financial resources there are available in the U.S. I don't really know about other countries because we do have people on here from all over the world, and there are financial assistance programs from the drug manufacturers. What a lot of times we'll have copay assistance programs and things of that nature. And then also there are nonprofits out there that have grants available. So always check into that. This is a good place to look starting out. And one other question that gets asked a lot, and I think this is one of the neatest things about the Knowledge Connect, is how do I apply for Social Security disability benefits with multiple myeloma? Click on that. It will tell you what the eligibility is, what medical documents to gather, how to apply, and how to follow up with them. Also, how to be prepared for appeals, and it'll go into, and there some other resources available. So once again, you can dig into that. And every one of these you can share. You can just copy right here and post it. You can post to Facebook, you can post to email. There's also a place right here. You can also join discussions about this topic. So Knowledge Connect is just a really, really powerful tool. And also right here, you can actually ask it any question you want to. And it will only answer medical questions. And if it ever gives you a message that says that it can't answer that, just say for a multiple myeloma, and then it'll answer it. So very, very powerful tool. And then also we have a blog available, and we've got a lot of different topics here where we've interviewed people, and the top Polygon team has, and a lot of great topics there. There's also some videos in there, and we've got some podcasts. that we've done. So where people are telling their stories. We've also, here's an example. We've interviewed some doctors right here. Adam Lang at Dana-Farber. He is a social worker, a cancer social worker at Dana-Farber. So we've also interviewed quite a few patients. My story's in there, as well as many others that are in the group. So once again, you might want to check that out. A lot of really, really positive stories in here of hope and people that have overcome just tremendous, tremendous odds. And that's very, very powerful. So I hope you found this beneficial. And this technology can actually be used for any disease. One other thing I want to show you about the map, I knew there was something I was forgetting, is you can actually filter what you want to look for. So I'm just going to take everything off here. And if you want to just see patients in your area, you can click right here and you can zoom in. And I'm in Louisiana, so I can actually look around at all the people that are around me. And I'm going to zoom back out. And this map is global. We have people from all over the world. And we have not really had this open for global very long. So I'm very impressed that we've been able to get as much exposure internationally as we have. So a lot of people in the UK. And we also have people in Australia, New Zealand, just the word's getting out there finally. So going back to the selection tool, we can select for caregivers. We can look for healthcare professionals. Treatment centers. We have a lot of the major treatment centers on the map. We also have local support groups. Most of them are IMF support groups. We were able to get their list and put on the map. We can add other support groups, and we will be doing that over time. We also have some patient lodging options. And these are typically free or low-cost places. They're nonprofits, charities, things of that nature. So I'll go to give you an example. In Arkansas, this is Home for Healing and Goodness Village. Goodness Village is who I stayed with when I was there. They have some apartments, just amazing. Ministry. So, and one other thing I'll show you about this is we recently had a fundraiser. There were a few guys that wanted to support a friend of theirs that had multiple myeloma, and they wanted to raise money for multiple myeloma causes. They called it Wheeling for Healing, and they rode e-bikes from coast to coast. And we actually put this on our map so that people could track it. And we actually, the pins changed color as they made their stops along the way. So we were able to keep up with their progress on the map. And so it shows the power of Patient Connect and the ability to even assist in fundraisers. So we're just really happy with this, and we've gotten a lot of positive feedback. One of the problems with getting diagnosed with something like multiple myeloma is that you feel like you're alone. At least a lot of people do. And it's nice to be able to look on a map and just say, you know what, there are some people around me that know what it's like to go through what I'm dealing with. Nobody understands like somebody that has been through it. And even from a caregiver's perspective, I don't know what it's like to be a caregiver. My wife has been through that. I can try to understand, but maybe you're a caregiver and you just need to talk to somebody else and just say, hey, I need somebody that understands. So whether you're a patient or a caregiver, it's good to connect with other people that are going through what you're going through. So that's really about it right now. We do have some new features that will be coming out soon. We're always trying to make this more useful and more beneficial. We do believe that this technology is the first of its kind that is patient driven and not disease driven. As a patient, I looked at it and said, what am I not getting that I need? And how can we use this? How can we help people find all of the resources that are available to them out there? And so the goal of Patient Connect is to connect patients and caregivers and healthcare professionals and researchers and nonprofits all together in one place to make those resources easier to find. One other thing I will point out real quick is that we do have announcements. Like we've got this, right now we have a program going with PSG. We made an announcement about that. And, at the beginning of the year, we made an announcement about all the financial assistance programs that are available. A lot of people responded that they didn't know about those. I know I didn't when I first got diagnosed. So there are a lot of powerful tools with Patient Connect, and we hope you'll find it as beneficial as I do and as many do. So have a good day, and let us know what you think.